going to be talking about fertility because it's important that you know your fertility. So we brought on set right now Dr. Hu Mei Lin, obstetrician and gynecology, to the show. Welcome down to the show, Doctor.
Thank you for having me.
It's a bit scary to talk about fertility, isn't it?
I think it's not something that people think about.
Yes.
So it's not so much that it's scary, it's just that people don't think to talk about having babies. I think when we are younger, we all talk about not having babies, right? So we don't want an unplanned pregnancy. But then we assume that as soon as we throw that condom away or we stop the pill, we're just going to, boom, have a baby and get pregnant. So I don't think we ever plan to not be able to get pregnant when we are ready. So that's the biggest issue, I think.
I think it's brilliant what Doctor just mentioned, right? You know, it could be a planned thing, it could be an unplanned thing, but more often than not, it's probably unplanned.
Correct.
All right. So, Doctor, I just want to ask you, of course, to our viewers at home who are watching, how important is it to be aware of your fertility?
Okay, I mean, I guess that's the main reason that we're all here today, and that's to have a conversation. So I think it's important for us to start talking about fertility because there is a reluctance to even talk about sexual education, and it's all a continuum. So I think let's not wait till there's a problem, or we're trying to have a baby and then suddenly, alamak, cannot have a baby. So let's be proactive about it. So nowadays, everybody talks about health screening. I'm sure you guys know what your cholesterol level is, right?
Let's be honest, health screening is very, very scary for me.
Okay, all right.
Try to avoid it.
but you know, none of us actually know, you know, are we going to have problems getting pregnant later? So I think if you are more aware that, maybe got problem, or maybe I can have a problem, then you are more prompted to go and seek help earlier rather than later. So it makes for good planning, I guess, in the future.
So what's a late stage? What's considered as a late stage? Not, okay, knowing that you have a problem, obviously it's too late, but what else is considered as, okay, you know what, you're a bit too late lah.
Okay lah, my motto is it's never too late.
Okay.
But for a woman, actually, because we all have a finite time. Okay. So for a woman, we are born with the number of eggs that we are ever going to have. So we are like a bank account that cannot deposit anymore. Okay. So it's only withdrawal from the time. So we actually have the most number of eggs when we are in our mother's womb at about 20 weeks of gestation, which is equivalent to about 5 months of pregnancy. By the time we are born, we're only left with maybe you know, 1 million eggs, and then by the time we hit puberty, 300,000 maybe. So there is a time, right? So usually the rule of thumb is probably around 36, 35, 36. That's the rule of thumb for women. For men, it's not as clear because men can make their sperm and you get a new batch every 3 months. So, but after 40, there is an increased incidence of issues with children born to older fathers. So there is a time limit as well. So I think mid-30s lah. Let's complete our family by then. Let's not wait till then.
I don't have the exact number, but I read that as recent as 2013 that the fertility rate in Malaysia is right now on a decline.
It is.
It is on a decline?
It is.
May I know why? What are the factors? I mean, of course, there are a lot, but can you explain?
I think a lot of women who graduated with me are unmarried because we've put off childbearing until we finish our exams and everything. So women are getting married later. Women are also more active participating in the workforce. So they are getting married later as well. So later marriage, delaying, childbearing, work-life balance. I want to travel the world first before I have my babies. Then the economy, it's expensive to bring children into the world now. So not like those days, my grandfather had 7 kids, you know. My father had 4, I have 2, you know? It's getting less. So I think these are a few contributing factors. Childcare, economy, women are wanting to pursue their career and education a lot more. So these are few of the factors.
And how do we fix this? I mean, is it really a huge problem? Let's say this fertility rate is, they continue to decline for some time. I mean, what could be the impact to the country?
Well, I think the impact to the country is mostly in economics, okay? So you have a certain amount of time where you participate in the in the workforce, right? And after a certain amount of time, then you retire. So as you can see, actually the retirement age has gone up and up and up, right? In my father's day, I think the retirement age is 50 or 55. Now they're talking about 60, 65. It's going to be 70 by the time we get to retirement age, you know. So that means that people will have to participate in the workforce a lot longer. And then there'll be less young people to come to replace them. So that's the bigger issue, right? Who's going to take over the workforce? And then there will be no more younger generation as well. So the economy is just going to...
Whoa. You can see, right? From fertility, they went to the economy.
Correct.
And now we're going to come back, bounce back down to the fertility rate, of course.
What happens in the bedroom can affect the country.
Of course, right? These are some of the stuff that, you know, if you were to think about, then probably perhaps it makes more sense, right? But let's talk about misconceptions about fertility, doctor. Talk to us about that.
So the common misconceptions that I get is that we have infinite time. Okay, of course, this is not helped by the fact that there are celebrities who are having children later and later in life.
That's right.
But what people don't realize is probably most of these women who are having children beyond the age of 40 possibly will have had some assistance in terms of fertility treatments. So I think the biggest message out there would be, don't think that your time is forever. You know, that there is a ticking time bomb going off.
Right, ticking time bomb, and time is ticking. We're going to take a short break. And we're going to come back more with Dr. Who. Stay tuned and please don't go anywhere.
Is it difficult for you, for a Chinese guy playing the sitar?
In 2025, Malaysia opens its doors to ASEAN, a celebration of unity and culture, bringing every moment of ASEAN 2025 to you, only on RTM.
Cultivating urban farms for a sustainable future.
Recently, we are talking about addressing the mental health crisis within the healthcare system.
And then, of course, expectations from the public.
How these people are so into farming. Even
cities grow and populations rise, there's the question of how we access food.
All right, we are back with Dr. Who, Mei Lin in the studio, and we're going to continue to talk about fertility. All right, so, and of course, when we talk about fertility, sometimes it affects either one or two or both people in the marriage or whatever partnership that is going on at that moment. And sometimes there is this accusations, or maybe it's you, maybe it's me. So it's always better for us to go and check ourselves. And is there a way for you to know beforehand? Is there a way for you to track and monitor your fertility over time?
Okay, so I guess if you've been having unprotected sex and you are not pregnant within 6 to 12 months, then that should actually prompt you to go and seek treatment with the fertility specialist. If you are a woman and you have painful periods, or your periods are just very heavy, or they are irregular, meaning that they don't come every month, that should maybe also prompt you. And if you have having problems having bedroom action, so basically problems with erection or ejaculation, or some women have experience very, very bad pain during sex, and that's vaginismus. So that all also may point to the fact that there may be an organic problem that can be solved. So all these are just in a nutshell what to look out for in terms of a couple, so and that might prompt you. If you've had a cancer diagnosis as a child, that also may have affected what's happening in your body. And then if you look back into your family and you see that, oh, you know, even my parents had problems conceiving, or if my mom had issues like this, my dad had issues like that, that can also prompt you. So your surroundings and what you're going through yourself is probably your best indication.
I mean, the picture here is very huge, right?
Yes.
It's massive.
It is.
Well, what about diet? You know, let's talk about dieting and all those kind of stuff. Would it help? Would it impact?
Of course. So usually when my patients come and see me, I would like to say all those unpopular things, you know. Exercise more, have a healthy diet, not nasi lemak every day, no alcohol, stop smoking.
Right.
You know, those are the things that they say. So it is true, it's very boring because everybody tells you to maintain a healthy lifestyle and maintain a healthy weight. But it does go a long way in terms of preparation for pregnancy and fertility. So, yeah, it does actually. But then extreme sports and extreme dieting, and that also is not good. So everything in moderation.
Yeah, everything in moderation. That's the word.
Moderation.
Balance, moderation.
Yes,
Yeah.
especially to those who are about to get married, and maybe they want to know the fertility states of the each other's partner. And of course, when we talk about fertility, it is a topic that can be quite embarrassing to some people because it pertains to sex. Maybe if you don't think so, I'm quite sure that there are some audience members out there who are a bit like that, Doctor.
Let's not talk about audience members, okay? Some doctors are like that too.
Some doctors are even like that.
It's just I talk about it every day, right? So it's like muka tak malu now, okay? So, yes, that's a very good thing, right? And I would like to say that that is a great step forward if you can go for what we call preconception care or get to know your partner. You know, maybe you want to check to make sure that all the guns are firing before you make the commitment to jump into marriage, right? Okay? So, yeah, so for guys, actually it's pretty simple. Okay, it's a sperm check. So basically, you deposit your sperm into a cup and we look at it under the microscope. And from there, we can tell whether or not you are producing healthy sperm. For a lady, basically, you come, you see a gynecologist like myself, a fertility specialist will be better. Then we will usually do a normal gynecological check. So that would be like he's taking a brief history, having a chat, having an examination, and then maybe we'll do an ultrasound to make sure all the organs are working, and some blood tests. And that's usually it. It's not rocket science. It's not difficult.
Very straightforward.
And it's very straightforward. And actually, we should actually view it as just normal screening. Like, I believe that Muslim couples, they need to undergo certain blood tests and counseling before they get married.
It's the same thing.
Add that on. Yeah.
And it only takes one day for both partners?
Yeah, a couple of hours actually.
Couple of hours.
Not even
not more than that.
How you know, Nabil, all this, huh?
No, I'm asking because I want to find out. And I think for those who are a bit embarrassed, okay, if we were to paint the picture of what the process is like for you, maybe you would want to go have your fertility checked.
Yes. But doctor, question is, right, how can early fertility screenings, you know, potentially identify problems, you know, reproductive health issues that, you know, may not be, I would say, obvious?
Yeah, I think it might not be obvious to you, but it certainly would, I hope, would be obvious to the doctor that's treating you, right? So, for example, if a guy comes and they've got a lower sperm count.
Right.
Okay, so maybe we'll just say, oh, what's happened? You know, have you had a sports injury? Did someone knee you during football one time? Did you have mumps when you were growing up? So all these can affect your sperm count. So for a man, it can deteriorate over time as well. So maybe when you've met Miss Right or Mrs. Right, by that time you have no sperm, then you are really in deep trouble. So in that case, you can opt to freeze your sperm for future use.
Right.
That's one, right? For ladies, if let's say they have conditions of painful periods like endometriosis, for example, which is another whole segment, right? So basically what this disease can cause is severe scarring that might block the tubes and all that. So then we can say, oh, okay, maybe we can put you on medication to control the disease so that, you know, when you go to have a baby, then you have a better chance of falling pregnant. So there are things that we can... So basically, I think fertility screening is like screening for any other diseases. We put measures into place so that you avoid fertility treatment like IVF and things like that. And we just want to increase your chance of being able to conceive naturally.
Just a quick one, Please. Where do guys go? I mean, you mentioned if you check the sperm count and all that. They can't go to gynaecology, right?
Why not?
Oh, why? Oh, okay.
Boleh.
See, I help you out there. I help you out there.
Yeah.
Right.
There are male fertility specialists as well, and if you are uncomfortable to come to a female gynecologist, you go to a fertility center, any fertility specialist, and they'll be able to help you out.
Thank you, Doctor.
Yeah.
Doctor, I want to know, so you go to the fertility center, you get yourself checked, and then the result is negative, it's not good. What do you do after that, Doctor?
Oh, it means, well, it depends what you mean by negative, right? So for a guy, it's actually very simple. If let's say, okay, I feel bad for saying that it's simple, but if let's say your numbers are down, all right, or the sperm is not swimming properly, okay, which can happen, okay? Actually, you only need a few sperm lah. Most of you guys are multi-millionaires, means that you produce lots and lots of sperm. If let's say your numbers are small and the boys are not swimming and it looks to be abnormal, big head, weird looking, it doesn't matter. IVF can help you, right? So IVF is a process which is short for in vitro fertilization. So basically we take the eggs out of the woman's body, we take the sperm out of man, we put them together in the lab and we form an embryo or a baby, and then we pop it back into the uterus and hope that it sticks. And if it sticks, then we have a baby. So there are things that we can do.
So it's not all doom and gloom?
No, certainly not.
Right.
Certainly not.
But what are the common male fertility problems, Doctor?
The common male fertility problems mostly involves, okay, so there are three parameters that we look at when we look at semen, right? So we look at number, okay, their ability to swim, and how normal they look, because an abnormally shaped sperm cannot fertilize an egg, all right? So this can come in so many ways and in so many forms, but one of the commonest is probably, if it's a genetic one, it's a problem with a microdeletion in the Y chromosome. So men, XY, females, XX. So in men with a microdeletion in the Y chromosome, they sometimes have very, very poor number sperm, and the sperm is abnormal, and more importantly is that they can pass this down to their boys.
I see.
Right? So this is quite common. And if in that case, then some men elect not to have male children. They only have female children, so they don't pass the gene down.
I see, okay.
So that can be done through IVF and genetic testing. The other thing that can happen is that the man can have a varicocele. So a varicocele is some extra blood vessels around the testicles that abnormally heats up the testicle and causes abnormality in the sperm count and the sperm number. So sometimes by fixing this varicocele, we can achieve a normal pregnancy. Now, that normally is done by a urologist, who is a equivalent of a gynecologist for males.
For male, okay.
And I was taking notes. The camera wasn't on me, but I was taking notes. But of course, we are nearing the end of our segment. But maybe to those who are watching out there, especially to maybe people who just got married and they want to have children, looking forward to that. If you have some tips for them, I mean, you've talked about stress, you've talked about diet, but if you have, I don't know, more practical tips for them to, you know, for us males to keep the boys swimming and for the girls to have their eggs nice and steady. All right. What would you say, doctor?
I would say adopt a healthy lifestyle and just be aware of what the potential problems might be in the future. So I think the easiest way to do that is to seek help. So there's so many doctors out there who's willing to help you with that. Then on top of that, I always tell people also, the other thing is belum cuba belum tahu, okay? So if you haven't started trying to have kids, I mean, come on lah, you know, don't say you cannot, right? Okay? And then if you're having trouble in the bedroom, don't feel shy to come forward. It is not normal to have pain during sex. It is not normal to not be able to sustain an erection, or it's not normal to come too early or cannot come at all. So all these things are things that we don't talk about, right? Bedroom action problem, right? Okay, so if you got bedroom action problem, please come forward. Don't be shy, okay? And don't wait until, oh, we've been married for 15 years. I'm now 45 years old. Now I want to do IVF. Don't wait too late. Okay, so seek help early. Okay, be aware and come forward with your problem. Don't be shy. We are not shy one because every day we talk about this many, many times.
But your mantra is still, it's never too late, right?
It's never too late.
Okay.
Right. Okay, there you have it. Thank you so much, Doctor, for being on the show and to talk to us about fertility and what we can do to, ensure proper family planning, as I would say.